I was fortunate enough to interview Hendrik Freeke, the renowned cosmetic dentist from the UK, for my book, Free the Hidden Speaker Inside. And today we're fortunate again to have Hendrik with us. He's going to chat about dentistry and how it affects our speech. Hendrik, it's good to speak to you. Thanks for joining us.
Oh, it's nice to be here.
Could you begin by explaining to us what is the relationship between good teeth and good speech?
Mariette, I think we understand that when you're making sounds, your teeth and your oral cavity has to be in a certain arrangement to be able to make those sounds. That has a bearing on where our teeth are and where they sit in the mouth. So that certain sounds can be made either with the lower lip against the upper teeth or with the tongue against the upper teeth. So if our teeth are not in the right place in the upper arch, you won't be able to make those sounds, and it will sound differently, and that might lead to some form of impairment or speech impediment, which could possibly have an effect on the person making a speech in a public environment or for natural day-to-day function.
I agree with you wholeheartedly. I think your teeth, not only as far as your appearance goes, but if you have a lisp or find it difficult to pronounce your words,
yes,
I'm sure that really impacts your confidence.
It does, and a lot of research has shown that if you know personally by looking at the mirror and just to hear yourself and see what your own appearance looks like on the mirror, you will also project that to the outside world in a much more positive way. And we've seen the change in people when certain things have been corrected on the teeth. That might be alignment of teeth or even just a color change in some of them, or sometimes closing gaps between teeth that cause lisping and things like that you mentioned before. So if some of those things are corrected, there's usually a massive positive energy and acceptance from the speaker to know that they are looking good but also sounding right.
You are so right. You once said to me, when I interviewed you for the book, you said that people with good teeth speak to the world in a different way.
It's just that confidence, isn't it? It's that they really, really know. There's nothing negative about that aspect of there. They need to know their subject, and then just give that over to the audience. So that's very, very true. I've seen that over and over again.
I agree wholeheartedly. But Hendrik, we know that cosmetic dentistry is really an expensive investment in yourself. And I think it may be a good idea for a speaker or somebody who's entering into a new business, an entrepreneur, to almost regard that as startup costs. Do you agree that one should invest in your teeth?
I think some of the dentistry can be quite expensive, and it can be a capital outlay initially. Not all the things we adjust and change is always expensive. A tooth whitening course will take about 2 months to achieve a whiter shade of your own teeth, and roughly speaking, that's about £500. So it's not a lot of money to invest in something that just looks better if you already have good teeth and they're sitting in the right place. But once you go to things like alignment of teeth, when they are standing in all directions, you've got to align them. You probably need some sort of aligner therapy, or even fixed braces, train tracks as they used to be called. And that can be several thousands of pounds of cost. Sometimes you even have to use a little bit of porcelain veneer work or even some crown work to get the right shape and color to give you the desired look or appearance that you want. And that can be thousands of pounds. That could be up to £20,000. So there's a wide range of things depending on your own situation. So cost is definitely a factor, but just always speak to a dental professional just to know what options you have for a start. So at least it's an informed process where you decide for yourself where you want to go with that. we always try to work as conservatively as possible. And if it just means bringing teeth in a better position, then it's still your own teeth, and they can then be whitened slightly and have a fantastic result. But in some cases, when somebody have, for instance, an antibiotic-stained tooth, which is a tetracycline antibiotic staining, which gives you a very dark grey colour on your teeth from childhood, for those patients, it's usually meaning porcelain work, and that's why I say that's the only solution, because whitening really doesn't work there. And if you want to get a $1 million smile, you'll have to invest some money, and that could be thousands of pounds.
You've mentioned before in my previous interview with you for the book, you told me the story about that beauty queen with that one tooth that appeared grey.
Oh, yes. Actually, in her case, it was in America. It's one of the states' beauty queen, and one of my colleagues treated her in America, and he shared with us the case, and we could judge for ourselves. And what was interesting there is beautiful lady with beautiful shaped teeth, I think a nice color of teeth, but she asked him to do porcelain work, in other words, about $20,000 of work on her because she wants to enter this pageant. And when he looked at her, it was just her teeth were inclined backwards in her mouth so that the light reflecting down made the teeth look darker, more grayish darker. And after evaluating the situation, he just asked her to go through a course of orthodontics where the teeth were just brought into a normal angle. And the moment that was achieved, the result was amazing because she had light reflecting teeth, which reflected light back at the person viewing the teeth. And we saw the slides of the case, and it was no whitening was done, but you could not believe that the angled tooth downwards is so grey. And once it's brought straight into a normal flatter position, it just looked bright. And that was all they did. It was just the alignment of the teeth, and it wasn't very expensive, and the result was amazing.
Well, I hope she went on to win the crown.
I don't know what the end result that was.
Anyway, so tell me about teeth hygiene and what we can do, even if we do not spend a lot of money, but how can we maintain our teeth and look after them?
I think, again, it comes to one of the aspects is the alignment of teeth. If they're overlapping a little bit, more food particles will gather and hide between those teeth that are sort of overlapping a little bit. They're harder to clean because the lips and tongue have a self-cleansing action if the teeth are straight. So if they're not straight, the tongue misses those nooks and crannies that food particles can hide in. And that usually is quite embarrassing if you have a piece of broccoli or something sitting there and you in a situation where you speak to people and they can see the green piece there, but you don't know it's there. So that's one aspect is, again, if the teeth are aligned, it's less likely to happen. As we grow older, our gums tend to recede a little bit, which opens up a few more spaces between our teeth. And those need to be cleaned daily as much as as often as you can, really. But we advise that people just use these small TP brushes, and they can be used between every tooth. I've got one here. It's a tiny little bottle brush like that, and it's got a small little cleaning agent, and that gets pushed between the teeth, and all particles will be removed from the areas between the teeth so that it's clean at all time, because you get gum infection. If food particles sit there for longer than 12 hours, it really starts to affect the gum where it's sitting against, and some of the lytic enzymes in your saliva will start to dissolve those pieces of food, and unfortunately your gum sits next to the food, so it will start to dissolve the own gum as well. So that way you get more and more gum loss, and your teeth look longer. That's where they're getting longer in the tooth saying comes from, because you just show so much more tooth and less gum.
Now, just before we say goodbye, I'd like you to explain to us, people so often talk about the perfect smile. What, in your opinion, is the perfect smile, and how can we achieve that?
The perfect smile is by way of an algorithm, is something we use nowadays where you just take an ordinary scan, and that scan of your current teeth as they are is then sent to our laboratory in Madrid, where an algorithm is used to determine the perfect width and length ratio, which is part of the golden proportion. And it will propose that for your mouth, for the teeth they see on there, that the teeth should be a certain length and width. And then that is translated into something like either porcelain crowns or porcelain veneers to achieve those lengths, because it usually means we're adding maybe a millimeter or maybe a millimeter and a half sometimes of length to the crowns to get the perfect proportion. So that gives you the perfect smile from a science perspective. There's still a little artistic interpretation as well, where we look at how those teeth sit in the face, and little adjustments can be made accordingly. But in a case like that, that gives you the perfect smile because it has a certain contour around the mouth where it follows the lower lip to the back. That's the way the upper teeth are shaped and slanted. And you see a little bit less of each tooth towards the back as well. And you see the full size of the front two teeth. And once the size becoming less and less and less visible. So all those things are worked into a visible ratio. And that's how we work out with this algorithm how to do it. And then we have the ability to have a mock-up, which is something printed, so a acrylic printed process where they give you fake veneers, little temporary veneers, which you can just basically place on the person's teeth without doing anything, and maybe take a photograph or look in the mirror and just see what that ratio would look like. And usually that's quite a powerful experience for the patient to see without doing anything what this ideal smile will look like in their mouths.
Are you one of those people who, when you meet a person for the first time, you immediately look at their teeth?
I think it's such a big part of the facial expression, isn't it? Eyes and teeth are probably the two things that people always pick up on instantly, and I do too. And also, I can sometimes just see little things that I could do for such a person, and it's sometimes hard not to express your views unless it's asked for. So, but yes, you can see the end result already in your mind because we do so much of it, so you know exactly how the end result should look like.
It was great talking to you, Hendrik. Thanks a lot and goodbye.
Thank you, Mariette. Goodbye.
We spoke to Hendrik Freeke, a dentist from the UK who specializes in aesthetic and reconstructive dentistry. And we spoke about how better teeth can actually produce better speech. Tune in again next time. It's Mariette, your personal speech and performance coach. Until next time, bye-bye.
Post your questions on LinkedIn to Mariette Richardson or email them to mariette@myvoiceuk.com and include a photo, or ask your question in person in a short video clip. And don't forget to subscribe to our channel to see more tips and say goodbye to performance uncertainty.